all. Today we are going to do OBG subject. In that, as per your syllabus, first unit, define the terms is there. You can check in your syllabus. Okay, so we are just going to discuss about few terms which we are going to discuss in other upcoming units. Okay, and this will be asked for you for fill in the blanks and 2 more 5 marks and all. Fine. So let's start. The first one is midwife. So what is a midwife? Midwife is a health professional. Okay, it's the same like a nurse. It's a health professional who take care of the mother and the baby at the time of childbirth. Fine, is it clear? Who takes care of the mother as well as the child at the time of birth, okay, delivery. And this is a specialization course. We say it as midwifery, which is a term for 6 months or 8 months. Okay, we say it as A&M and all. They will be specialized trained nurse to take how to take a delivered baby, how to carry it, how to give birth for the baby, how to do a episiotomy. Okay, this all will be taught for them. That is a midwife. Is it clear? Next, moving on to gamete. In the reproductive system, and assignment I have asked you to write it, right? So what is a gamete? A gamete, for both male and female, there is a reproductive germ cell. Reproductive germ cell. That is known as gamete. In male, it is spermatozoa. In female, it is ova. Okay? What is a zygote? Zygote means a sperm and the ovum getting fused together in a favorable temperature is known as a zygote. Zygote means a sperm and a ovum fused together to form a cell. Okay, in a favorable temperature is known as a zygote, and that zygote will be in the uterus, which is embedded by the uterus layer. Uterus layers are 3 layers, right? So the innermost layer is endometrium. So endometrium will be lining it. Okay, and at the end of 40th week, till the gestation of 40 weeks, 38 to 40 weeks is a normal delivery gestational weeks. Okay, till that the uterus will be the protector for the zygote. Okay, what is a menarche? What is a menopause? So before knowing that, you should know what is a menstrual cycle. Okay, so menarche is the first menstrual cycle in a female's whole cycle. In a whole cycle or a human being's life cycle, first bleeding or first menses is known as menarche. Menopause means the last menstrual cycle in their lifetime. So the last menstrual cycle, we can say it has ages above 45 years, or due to some of the disease condition secondary to that, menopause can occur. Okay, that is about menopause. Presentation means not giving gift. Okay, presentation means by the time of delivery, okay, which anatomical part of the baby is coming out, that is known as presentation. Sometimes baby's head can come out, that is known as vertical presentation. Sometimes baby's buttocks or legs areas coming out, that we say is as breech presentation. Okay, presentation. Understand? Show means it is like at the time of 40th week of gestation, 40 weeks of gestation, there won't be any bleeding in a pregnant lady. Okay, there won't be any menstrual cycle in a pregnant lady. But as the date of delivery occurs, what happens is like the blood canals or the blood flow, blood stained bloody discharge from the uterus, which is mixed with the mucus, it is shown, okay, which is not a good sign. So we will take the patient for the labor immediately. Fine, that is about a show. What is a vernix caseosa? Vernix means when the baby is delivered, you might have seen a creamy, cheesy, whitish thing on the baby's skin. Okay, that when you give a first bath, you wipe it. That is known as vernix. Okay, vernix caseosa, we can say it as vernix also. Okay. The next one is amenorrhea, dysmenorrhea. Amenorrhea means absence of menstrual cycle. Before a menarche, it's a amenorrhea. After a menopause, it is also a amenorrhea. Dysmenorrhea is like any word starting from dys means difficulty. So a few people will be having difficulty in the menstrual cycle. Like stomach pain, cramping, vomiting, dizziness and all. For them, dysmenorrhea, we can make it. We can say that the difficulty or the pain during the menstrual period is known as dysmenorrhea. Next one is lightening. Lightening means a pregnant woman at the before the delivery, okay, when the you might have seen a pregnant woman tummy and all will be little high, like, so that time what happens, like the pregnant woman will have a feeling that the baby in the womb is coming down, okay, it's coming down, okay, that is known as lightening. The pregnant woman feels the baby drop to the pelvic bone. See, their abdomen is like that, pelvic bone is there. Now from the baby's head, or which is the presentation part, if it is buttocks, that is dropping down to the pelvic bone, which is known as lightening. Puerperium means after the delivery, once you deliver the baby, placenta will be there, right? Placenta, after taking placenta, few weeks, or you can say it as first 6 weeks is considered as puerperium. After the delivery of placenta, means first the baby is taken out, then the placenta you will take it out, right? So the first few weeks after delivery, it is known as puerperia. Okay. Lochia. Lochia means it is a vaginal discharge after giving birth. After birth, like for 9 months there is no menstrual cycle. So after the birth, the discharge which is coming from the vagina will be containing blood, mucus and uterine tissue, that is endometrium. Okay, that is known as lochia. Okay, next one is polyhydramnios. Polyhydramnios is a condition. See, we know our baby is in a amniotic fluid or amniotic sac. Okay, a baby will be there in amniotic fluid or amniotic sac. Polyhydramnios means the excess amount of amniotic fluid, okay, in the womb is known as polyhydramnios. Poly means excess. Okay, next one is amino synthesis. Amino synthesis is a chromosomal abnormality, okay, for the determination of sex. Okay, it is a medical procedure we do it. Amino synthesis is a medical procedure used in the prenatal diagnosis. Prenatal means prenatal, before birth. Okay, diagnosis of chromosomal abnormality of the fetal or the baby, and also for the sex determination. Okay, that is known as amino synthesis. Pelvic abscess. You know, abscess means pus formation. Okay, pelvic abscess means it is the end stage in progression of genital tract infection. Okay, when the pus from the fallopian tube spills into the ovary and infects the follicular rupture and direct penetration. Okay, pelvic abscess means abscess, pus formation through the fallopian tube to the ovary. Okay, and that in bacteria, virus or whatever it is affecting, it is penetrating into the pelvic bone. Okay, that is known as pelvic abscess. So I think this is enough for today. I hope you all have this notes also I have given to you. Fine. Just see whether this is understandable for you people, or you want me to give PPT class also. You can just give me a feedback later. Okay. Bye. Take care.